The TARGET-HPV trial is a trial at the University of Chicago in which we are evaluating neoadjuvant HPV-specific immune therapy, HB-200, in combination with chemotherapy for local regionally advanced head and neck cancer, followed by de-escalated local regional treatment. The part that we'll be presenting during the oral presentation at ASCO this year is actually the Phase I part of the trial, in which we are evaluating escalating doses of both HB-201, single vector therapy, as well as HB-202-201, alternating viral vector therapy at escalating doses in the neoadjuvant setting in combination with chemotherapy. Overall, we found the regimen to be quite well tolerated, and we found that most of the toxicities were low grade, such as low grade fever and fatigue, related to primarily the first dose of neoadjuvant HB-200. In terms of preliminary efficacy results, of course, these are not the primary outcome of this Phase I part of the study, but we did see deep responses in 81% of the patients. In previous studies with chemotherapy alone, we've seen deep responses in about 70% of the patients, albeit this is a very small study, and so these are only preliminary findings. But interestingly, we did find significantly enrichment for deep responses among the higher dose level patients as compared with the lower dose level patients. And what was also interesting is we found that the vast majority of patients did experience expansion of their HPV16-specific T-cell response as compared to baseline, suggesting that the HB-200 given in the neoadjuvant setting is able to expand HPV16-specific T-cells. These are T-cells that are specifically targeted towards the tumor. In addition, we also found that all the patients with this neoadjuvant regimen did experience reductions in their circulating tumor HPV DNA levels, again, a key biomarker, preliminary biomarker for activity. And actually, the majority of patients completely cleared their circulating tumor HPV DNA during the neoadjuvant regimen. And so, I think the take-homes for this trial is that we're actually expanding this into the Phase II part of the trial at this point, which is currently enrolling HB-200 with chemotherapy, and we look forward to seeing those subsequent results as well. Ultimately, by deriving deeper responses with the incorporation of HPV-specific immune therapy, we hope that we're able to de-escalate more patients, thereby reducing both acute as well as long-term toxicities of full-dose radiation treatment for all patients.